We're now recording. Thank you everyone for coming. Given that some of you have had Lisa leave in the middle and, just the queries that are coming through on Moodle, I thought it might be a good idea to just have a check-in before assignment is due and give you a chance to answer any questions you might have in relation to assignment 2. So what I'll do is I'll go through the criteria based on what the rubric is. Okay, and give you a brief outline of what it is we're expecting. And then I will take any questions that you may have. Okay. So this one is looking specifically at case studies. So as you know, we presented you with 3 different case studies. There's the couples, there's the family, then there's the group therapy one. What we're looking for generally is if this was a client, how might you think about what information is present? So imagine the client's coming for the first session or second session, and the client's giving you all this information. So what we provided you in the case study is just enough to formulate. Okay. Of course, all the details are not going to be there because, we're not summarizing 15 sessions worth of work. A case formulation is where, as the client's giving you information, you're trying to work out what's going on for the client. So we've given you enough within the scope of a 2,000-word essay. We also recognize that you can't be formulating a thesis, right? So the first part of the assignment is the case formulation. And as I said previously, what I mean by formulation is what is going on for the client, very simply. What's the dynamics between the clients? Is there anything in there to suggest that this might explain the presenting issues? Now, what you use to formulate that can be a structured way, like the 5 Ps that some of you have mentioned, in the forums, but it can also be unstructured in that you might pick up an interpersonal dynamic, for example, and then you might want to explain why that's important. Okay, so if you're going to, I'm trying not to speak to the case generally because then I'm giving you the formulation, but I'll give you another example. Okay, so if we have a child and a parent client come, and the parent says to me, the child is throwing a tantrum, he's at school, he's so aggressive, he doesn't have any friends. My partner and I have recently separated. Now, there's a few issues in there that's mentioned, right? So all of that will become part of your formulation, the aggression, the social impact in school, the parent separation recently, which could explain what's going on for the child client. So if you say, well, maybe the recent separation has impacted the child's behavior, then find evidence to support that. Where is the evidence in the theory or the research to support that parental separation can impact child social emotional development in specifically aggressive behavior? Okay. You might find other things in there about, I might want to talk to the teacher, and perhaps if the mother says, well, the teacher is saying that it's not really a problem, but he's shy and withdrawn, that also becomes part of your formulation because there's now 2 representations here. One is the mother who's saying it's aggression, the teacher who's saying the child's withdrawn. Both will need to be connected to research. Okay. In assignment 1, what we have found is a lot of you have picked up accurate issues, okay, and discussed the client beautifully, your characters, but haven't linked that to research. Now, there's clinical relevant and academically relevant. So most of the essays would be perfectly clinically relevant because you've picked up the issues well. You've gone, yep, this explains why this might be avoided. This explains why this might be anxious, but it's not connected to the research. And then we have to mark you down because it's also an academic paper, right? So with the formulation, as you can see, then the higher grades are you've picked up most of the issues, if not all, and you have discussed the genogram. Now, the questions we have asked in the genogram is not everything we know. I know, that's fine. But you can indicate in the genogram sometimes that this is what you might want to follow up more. Right? Sometimes you might say, if it's not clear, it's not clear. Like I think one of the cases, the genders are unclear. That's fine. But, there would be a genogram symbol for unclear genders, right? Put that in there. We're also looking for dynamics between the clans. So in this case example that I gave you, if the aggressive behavior is towards the mother, could you depict that in a genogram that it's only directed towards the mother, for example? Okay, so the more detailed genogram, the higher the mark you have. A very simple, of course, will get you lower marks. The second part is the application for underpinning theories. Now, here we have, through the course, we've given you some theories and we've given you some models to explain it. While we'd like to see that, if you are so inclined to go and find something else that will explain your case better, by all means use it. So we don't want to restrict your creativity. We don't want to restrict your ability to go and formulate and support the case and with appropriate models. Please reference it appropriately. Okay, so just saying to me that vulnerability model, for example, making this up, could explain the case, then apply it to your formulation and to what is going on, because I need to see clear links between the case and the theory and models. Lisa, I'll give you a minute to answer all questions later, okay? And then, so special consideration and risk, I think this is fairly straightforward. Week 3, we covered some ethical principles. Some of you are doing the ethics course. So feel free to draw on principles there. In terms of citations, we do require you to cite well. Now, we don't require absolute details, okay? So I wouldn't go, back for code 1.1.4. whatever, because it's just, again, we recognize it's a 2,000 word essay. We require some level of citation, but not in-depth ones. A good thing to do here, and what students have done in the past, is put it in tables, because that sometimes takes away the word count, element of it. But if you're going to do that, don't give me the code book and say all of this is relevant to the case. Please make stronger links, okay? I know most of it will be relevant. What is applicable to your case? I need to see that connected strongly, okay? And we're looking at considerations of how you might manage this realistically. And so this could be ethically manage it as well as clinically manage it. And there's differences there. So if there is a risk identified, what would you do ethically? What might you do clinically? Again, not a huge deal, but we need to understand that you're thinking about the risks and thinking about how you might manage it when it comes to your clients. Okay. And then finally, we're looking at counseling strategies and interventions. Of course, this is going to look different for couples, for the families, and for the groups. For the groups, I think it's a little bit more tricky because you are in a group setting, but you can certainly use strategies that might be applicable in the group setting. With couples and families, it's a little bit relatively easier. Okay, we are looking for 4 to 6 strategies for your higher order mark. And again, simply describing the strategies isn't enough. It's applying it specifically to the case and referencing it. All 3 need to be present. Okay, so there's a description, there's evidence to suggest it, and there's applicability to the case. And then the quality of academic literature. Most times, when we give you a C, not everything within the C applies to you, as you would have figured out. So we actually, the way we mark is the rubric is put in on the, it's a generic mark. And then if we give you a C, for example, it might mean some elements of it are applicable to your case. So some students have gone, but there is no misunderstanding and there is no mistakes. I'm like, I know, but the flow might not be okay. There might be in-text referencing problems. There might be, when you're writing your reference sheets, that might not be fully applicable to the APA code. So what we try and do is give you more specific feedback within your essay to make sense of why we've given you this generic C or D or HD on this side, okay? Now, sometimes if that link is not clear, feel free to reach out and go, it's not clear. Can you explain this a little bit more? And I'm more than happy to give you feedback, right? But we cannot write individual notes there. It'll just take a lot of time. So we try and save our time to go, yep, it's a generic feedback. It's sitting within a C category. Within that category, here is why you may have been marked down. And the most common mistakes we see is the general flow of the essay might not be very clear. Sometimes we might see that there's a description on one end and the research given maybe later on, but the links between the two are not very clear. That will get you marked down a little bit. Okay, punctuation, grammar, errors. While generally most of that would sit in a C, for a P or an N, it has to be an N. Usually, it has to be pretty not understandable. Okay, or very gross errors in referencing. So if you're using a different reference style and not APA style, we will mark you down there because we have ours specifically for APA. Sometimes there's, too many spelling mistakes or grammar mistakes. And we do understand for some of you, this is the first time you are writing an academic essay. So we've tried to be as lenient as possible, but we will then give you additional feedback to go, can you think about this? It may not affect your overall mark, but it's just to think about what might you do going forward in the course. So sometimes we go, where's the introduction? Where is the conclusion? For a good academic essay, usually we have that. It's what we would expect. In assignment mark, we haven't marked you down for that, but we've just given you that feedback to think about it for future. Okay. Now, is there any questions around that? So I'll take your questions now. That's not clear. Okay. Lizelle. Okay. In case formulation, we don't identify theories yet, just what the issues are. Yes, that's correct. So it's what the issues are. Yep. April?
So I think linking with Lizelle's question, I'm just wondering, is there an avenue to actually combine like question 1 and 2, meaning the case formulation and theories? Because I started writing it, but I feel like just going straight into it without explaining why I'm doing it, it's a bit weird. And then the thing is that if I explain it in my second, like question 2, then I feel like I'm using a lot of words because I'm actually going back to question 1. The reason why I did this is this, or this is the model that I use. So can I actually join them together?
Yes, you can, and just indicate to the reader that that's what you're doing. Because sometimes what happens is we are expecting it a certain way, of course, because you're marking so many, in a go. So we will start to read and go, but where is it? And where is it? And where is it? But if you tell us, okay, this is how I'm, which is where the introduction is relevant. If you tell us this is what I'm doing, then I know that, okay, this is what I can expect from your essay. It's coming at some point, or it's combined at some point.
Okay.
Yeah.
And so with regards to that as well, like for example, if let's say I'm looking at the family the family case study, like obviously there are like many theories or many models, but if I just select one and I can justify that, and not to say the rest are not good, but it's just that I it's not possible to do it. But if I just go down one path and I can link everything to it, is that enough, or do I need to explain everything else or a general thing?
That is fine. As long as you
Okay.
can use one theory, because we're not saying multiple, right? We are saying one or more, because sometimes some issues can be explained by one, but other issues might not fit into the model, in which case you might need another model or another theory to explain. So you could absolutely use a combination. You can do one if all fits in within that, or you can do one or more if you feel like these issues can be explained with this theory or this model, but this issue can be explained with that, then use it.
Okay, because with most models, like there's obviously some sort of limitations or criticism. So like, but it's just like I think I'm like it's just not possible to be able to do this and that. I mean, I can link a few together, but in
Yeah.
general, like I'm just going down here regardless of despite the fact that there might be some limitations. That's okay.
Correct.
Yeah.
And then you know what a good critique would be? The limitations. So if you're then telling me that's what we're looking for in critical thinking, because then you're going, well, this model doesn't quite explain this, and this is the critique of this model, and I would like to consider blah, blah, blah. And so that's telling me you're thinking through it. That's critical discussion.
Okay. Okay. Thank you.
Yes. Who wants to go? Alyssa, you want to go?
Yeah, I'll go. I'll turn my camera on so you can see me.
Yes.
I am struggling a little bit with the genogram.
Yeah.
Because I've got like just a few questions about it. I'm noticing in a lot of like examples of genograms that I'm looking at, there's like male, female, mother with children. Obviously I'm assuming that's because like you know, biology reasons for like having male, female, but in a case description, when they're talking about like, oh, their family or their parents, can you assume gender in that case, or should you be not assuming gender at all when it comes to parents of clients?
You can
Obviously, like
assume.
in therapy, you would know, but it's really hard
Yes.
in the case studies.
Yes, so you can assume gender if you want. Just tell us that this is what you're assuming. So, we don't want you to create an alternate reality for the case. And so very often that detracts from the actual case. So some assumptions are okay. Don't go to town with it because you're simply wasting words and it's not going to help your formulation in any way.
Okay. And then I also, like obviously without being too specific to whatever case I'm doing, if it's like kind of alluding to something that's happened, it's like, I'm like, I don't want to like specifically reference the case, but like, if, someone's like not close with their parents, it's
Yeah.
like you're trying to draw the things that signify stuff, and it's hard to really know because you don't really know what type of conflict is going on. You don't
Correct.
really know if they're like completely not in contact or if something happened. So it's kind of hard to choose which symbols to use because you're not sure what's going on.
Yeah.
So would you suggest using like a generic symbol to identify that there's like some sort of conflict, or what would you do there?
That's exactly what I would do, a generic symbol.
Okay.
And alerting that you'd like to explore that further. So in
Okay.
the case I gave it the aggression, right? So I might go aggression, but I don't know. Maybe it's towards the mother. Maybe it could be somewhere else. I'd like to explore this further, what the aggression looks like. Query, father, is it happening there? So it's generic, but without going into too much details, but allude to the fact that you'd like to explore it further.
Right. So you would like a discussion, you would like a drawing of the genogram and then a discussion of it afterwards?
Not in depth, again.
Okay, yeah. It's
Not
so
in
hard
depth.
with the word
It is
count.
hard. It is hard with the word count. So I don't, the skill with this is if you can pick up the relevant issues, link it to theory, and link it to research, you should be okay.
Okay.
Okay, so don't get caught up on the details because your client's not going to care whether you depict aggression or, whatever, as long as you're noticing there's something happening in that relationship.
Yeah. And then, sorry, one more question with the genogram thing. So obviously you have like lines connecting people. So if it's like mother, father, child, that's like the main line. But then if there's conflict, is that like an extra line, or do you like express that main line with a conflict style? You know what I mean?
Either is fine.
Okay.
Either
Cool.
is fine. Because it's not going to affect your word count. So the only thing is you got to think about is your word count. How you depict that is on you.
Yeah. Okay. Perfect. Thank you.
No problem. I see a few hands. Okay, so I'm just going to go with what's popping up on my screen first. So, Lizelle.
Yes.
Hello.
Hi, Lovita. Hi, how are you? Now, welcome back.
Thank you.
Nice to see you again. Now, I just want to apologize that I'm in a doctor's waiting room, hence why I, had my earphones and all that on. But anyway, I'm gonna make this brief, so I don't bother anybody else. And I feel like I'm more confused now after going through this. So firstly, I just wanted to clarify your point about saying that this might be the first time that someone's, some of you are writing an academic essay. I feel like the first assignment was kind of, is the format expected to be drastically different? I understand that this is a case study. So is the format expected to be drastically different?
No. When I said first time, I was making reference to the first assignment, not this one. So because it's the first unit that for some of you, it's the first unit.
Got it. Okay. So in regards to the approach, it's the same, like the introduction sheet, the introduction, the body, the conclusion, and linking to evidence-based literature.
Correct.
So that's okay. Okay. I was like, have I just gone off the path and I have to start from absolute scratch? Okay, that's comforting. Then the second thing that I did want to clarify, because the information is wonderful, but the case study, within each of the case studies, the questions and then the details of the assignment have different sort of headings. So I just don't want to miss the point of. So the case formulation is absolutely clear. So what is going on? We can use a 5 Ps framework if relevant, and then it's really just as a therapist what the concerns are. Then linking it into theories and models. So theories and models obviously is interchangeable, and I don't want to obviously give out the answer, but is this the equivalent of discussing, say, EFT or behavioral therapy? That would be a theory, correct? Okay, perfect. And how that applies to what we have identified in the case formulation. Then going deeper, I've sort of rearranged it to go strategies and interventions and then go into risks and special considerations. So the strategies would then be how you would design the sessions and assuming multiple clients, how you would structure, single client, but multiple parties, how you would design your therapy intervention program to ensure that the client is at the center of it, while using strategies in regards to coaching, or I'm not giving out, but you know what I mean, but coaching or safe expression. You know what I mean? Is that what you're saying?
Yes.
Okay.
So your strategies need to also link to your formulation. So in the example I gave you with the mother and child, if I'm going to be dealing with the child's aggression, for example, then what strategy I might use to address that? Because that's part of my formulation, right? So I could use a family-based approach. I could use a parent-child dyadic work. I could use, and within that, what might I use? So, one specific strategy to address dyadic work, for example, I might use cognitive behavior therapy, correct, to address the child's whatever. Then I need to link it to my formulation. So that would be 2 strategies. So you can see where this is going.
Yes. So you're expecting 4 to 6 strategies
for a higher on, and linked well to your formulation.
Okay, but I also want to know, say, without,
it's tricky.
It is so tricky. So first is word count. Second is, I feel like almost every theory, sorry, I'm trying to use the right terminology. Every theory, there is enough there to say that it can be applied, but we only have 2,000 words. So I've just chosen the 2 best theories. So is that sufficient, or do I need to have 4 to 5 theories and then 4 to 5 strategies under
No.
each?
So one theory is enough, as long as you can explain all the issues in your formulation. Where that doesn't. So if you're using a model like EFT, because EFT tends to have attachment theory embedded in the way you are
correct,
right? So that's you can just use that and then use your strategies to talk to your formulation.
Support. Got it. So what you're saying is within each theory, aim to have 2 to 3 for the higher end, 2 to 3 within each theory, aim to have 2 to 3 strategies to support how each theory addresses the case formulation and how you can mitigate some of the presenting problems.
Correct. So for those who are doing one theory, that's okay too, because some of them would just take one theory, formulate the whole case based on that particular model. The strategies are 4 to 6 to address the issues, the what's going on.
Do you expect to see session 1? We will use the strategy. Session 2, that's not required, is it? No. Okay, because that needs to be fluid enough to be able to. Yes.
I mean, you can plan it, and the client would have a different plan. So no, I wouldn't expect that.
No, exactly. And lastly, what you mentioned about the table, what was that?
The ethics.
What are you expecting to see?
Ethical issues. So sometimes students would, because the multiple risks may, like multiple ethical issues may be relevant. Not telling you which ones. So rather than, for saving word count, they put it in the table, because tables are usually not counted in the word count. But as I said previously, don't give me the code book, link it to your essay. So
okay, so if I find ethical issues, whatever that might be, this is obviously a wider group type situation. So just make sure that write issue number 1, issue number 2, and then the relevant ethical framework to which.
Correct.
Well, that's really helpful. Okay, I thought I needed to explain that, but if you're happy with the table, You've minimized that. That's perfect. Okay, that's great. Thank you.
You're welcome. All right, Nora, I've got you next. Your hand up next.
Thank you, Professor, and welcome back.
Thank you.
So my questions were with specific regards to the treatment plan.
Yeah.
First, I wanted to double check because both yourself and I'm doing workshops with Professor Story, you both warned us against too many assumptions where we're creating a whole other backstory. But with specific regards to the case I've chosen, which is the couple, it does say in your last session, partner so-and-so did such and such, which, that indicates that already at least 2 sessions have happened.
Yeah.
So I assert straight up, I have had 2 sessions with this couple.
Yeah.
And then when I'm talking about what I shall be doing next, I'll say, look, this is or what hasn't happened in the initial sessions. I'll clarify whether or not I've had the individual sessions to assess for risk, but I won't be making up, this partner said this and this is what this person wanted. But we can go ahead and assert that. We don't have to assume it or state to the reader that we're assuming.
So
how do we state it?
I think it's okay when making assumptions or even assertions, right? My advice would be stick as closely as possible to what's presented in the case study. Like small things like this is a second session, it really, second or fourth session really doesn't matter. Okay, we can assume at least one's done. So, don't create an alternate narrative to what's already presented. Some assumptions are okay, but don't go too far with it. That's the most specific I can get here.
I understand. And then on that same note, when we're talking about strategies, interventions, and a broad action plan, it's very much a case of, again, with the couple, without saying too much, it ended on a bit of a cliffhanger. So would I say in that case, based on the fact that one person in the couple wanted to speak to me, I'll go ahead and do A. Now, while doing A, if this happens, then this is what I shall do. This is the backup. That if that doesn't happen, then
yeah, that's fine. And as long as all of that is then supported by literature. So because very often I'd be like, okay, but why? Yes, that sounds fine clinically, but where's the evidence that this will work?
Yes.
Okay, so that's the missing piece, I think, is finding evidence and finding good sources. So one of the other mistakes, not mistakes, it's fine, but an overuse on reliance on books, because books are basically an integration. It's not actually the research that's conducted. So what we're looking for is research that's conducted. And so in that way, you're going to go and look at the most recent research that's conducted that's going to support your formulation, if that makes sense.
It does. Thank you very much for that.
You're welcome. Kiri, you're up next.
Hi, thanks, Lavita. Okay, I've got a couple of things that kind of partially answered everywhere, so I'm going to try and be direct. The first one is in the lecture notes with the demand withdrawal cycle, how you got that kind of infinity that looks at that dance between couples. Nothing in those notes are referenced. Like how, if I'm going to use something like that to be part of my formulation, how do I reference it?
Isn't that part of EFT?
Yeah, but do you want a specific reference to say where that particular thing comes from?
No, just reference EFT and that should be fine.
All right. And then the next one is, and the only reason this is a problem for me is because I come from a different scientific area, but I get conceptualization and formulation often used interchangeably in things that I read. So I find that confusing, but also theory and model, I use them very differently to the way they're used in a lot of the stuff here. So I just wondering, like with a little bit of clarification, to me, a model would be something quite clinical. And a theory is something that might underpin the way you apply a model.
Yes.
That's how I would use medicine. I don't know if that's the same here, but I would think of something like EFT as a modality. I wouldn't think of it as a model, but I guess it's both.
It is because it embeds attachment theory in some ways, isn't it? So I think in that way we look at it as both. Okay, a modality is right because it is the way you would. That's technically the right way of looking at it.
Okay, so I would think of it as a modality, which means that when I'm looking at interventions, if I was going to use EFT as a modality and I was going to choose interventions that would fall under that modality or that model, whichever way we're looking about thinking about it, the way that, I guess this is kind of that thing that you do in, CBT, where it's like Rogers versus Egan, right? Like you've got
Yeah.
this really tight scripted idea of how you would apply EFT to a session, and you've got your 3 stages, and within those stages you're thinking about reprocessing and then restructuring, and there's
Yeah.
these different interventions that come under each.
Yes.
Does it matter, like, if I'm going to would I select a couple from, I mean, it depends on the formulation, of course, but
Yes.
if it would be like, well, there's a couple of things I'm going to select from stage 1 to get the clients to reprocess, and then there's a couple of things I'm going to select from stage 2 to get them to restructure. Is that kind of the right idea? I'm
Yes.
kind of trying to fit it. Okay.
That is absolutely the right idea. And you can pick something else completely not related to the EFT and go,
Okay.
"Oh,
Okay, cool.
actually,
So it's pretty
behavior
loose.
therapy might, whatever." That's fine too.
All right. All right. Okay, cool. That's all I've got.
Wonderful. Thank you.
Thanks.
Who else to hang on? I've got some weird message. Okay. Priyanka.
Hi.
Hello.
Hi. So a couple of questions. One with the genogram. In cases that, in information that I do not know, am I allowed to put a question mark and then maybe explain in the description? Okay. Can I do that for gender as well? Because the diamond one was for non-binary. I'm not sure if it's one for the gender you don't know.
Just put the question mark. It's fine.
Okay, question mark. And the second one is the EFT cycle model. I know it can be used as conceptualization as well, like for formulation, but also it's a part of the model. So I was just wondering where it'd be more fitting to use, in formulation or in theories and models.
It doesn't matter.
Okay.
Yeah, as
that's
long as you pick up the relevant issues, it doesn't matter.
okay, fine. Thank you.
No problem. Who else do I have? April.
Oh, oops. Hi. I just a quick question. So with this, like it's an academic essay, but we've got question 1, 2, 3, 4. Do you want us to write like question 1 and 2, or like a heading of something like case conceptualization and theories model, and then we say that, and then we move to like strategies?
It doesn't have to go 1, 2, 3, 4, but some headings are always a good idea
Okay.
because it just alerts us to the flow of the essay.
Okay. And just a quick one. I know that the last unit that I did last year, there was a big, there were a lot of questions on word count in terms of whether diagrams and tables count. So I just wanted, and I think at the end of the day, like it all depends on what the lecture, like what is the final decision, because there was a lot of confusion. And with 2,000 words, it's very little. So I just want to clarify, diagrams as well as tables, do the word count for this?
No.
Okay. Okay.
Generally, with APA diagrams and word count, tables don't go
Okay.
into the word count.
Okay, no, that's great. Thank you.
And-
And just the last, sorry,
Yes,
and just
go
the
ahead,
last
go-
one is, sorry.
Go ahead.
And you mentioned that we need to do all the current literature and all that, which is fine. But then a lot of the theories that we do, the original meaning of it, like they come from books because they are like obviously like 30, 40 years or 50 years old. Like that's okay, like with the original reference to it.
Yeah.
Okay.
So seminal works like, Ainsworth Bowlby, of course, you have to reference their initial ideas because they were the theories behind it. But of course, like if you're saying in assignment 1, for example, avoidant attachment displays fear of intimacy or avoidance of intimacy, there has been loads of literature research done to actually prove that experimentally and more recently as well in particular populations. So we would have expected to see the original Ainsworth theoretical idea, even the strain situation, which she experimented on it, but more recently, blah, 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 has shown that this is also the case. So that's the kind of link we are looking for. So of course you make a reference to the seminal work, but then support it with more recent research.
Okay. Okay. And are you looking for justification in terms of why I mean, I guess that's probably linking it to the thing, as in why we actually selected a certain model for that.
Yeah.
Yeah.
Yes.
Okay. Yeah. Okay. Not a problem. Thank you.
You're welcome. Now I've got a couple of questions in the chat. Okay, so Ronald says, do the notes under the genogram symbol are part of the word count? No. But don't cram in too much there. Okay, so just make it as long as it's clear, so that it wouldn't. The genogram is it's a picture in my mind, so it doesn't count. Kate says, is just confirming that in-text references are included in the word count. Absolutely. In-text citations are. And then, do you expect us to write notes under the genogram to describe, and expecting us to link and explain it in the paragraph? I think if your genogram is comprehensive enough, you don't need too many words. But a legend sometimes can help. So, this is what it means. This is like, if you're going to use a squiggly line or whatever, then putting a legend at the side saying this is what it means might just increase the depth of your genogram. Okay, so not very comprehensive notes, but just enough to explain to the reader what it is you're trying to depict to me. And then, Urvija, are we required to write an introduction and conclusion? It's always best practice to write an introduction and conclusion. It doesn't have to be comprehensive, even if it's a few lines, just to alert the reader to what you're doing and then tying up points from your essay. Otherwise, it just feels very abrupt. Does that answer everyone's questions? More questions? Oh, Riddhi, okay. I'm not. So Riddhi asks, do we need to describe group counseling and how it works in the introduction? Briefly, don't spend too much time describing. Just spend issues in the spend the word count on the formulation and strategies. Very, very briefly. Okay. Isabel, do we put subheadings for each section? And if I combine case formulation and the underpinning theory sections together, how do I write the subheadings? Up to you. You can put subheadings if you want, but it's not necessary given that it's, I think we've got fairly discrete sections. So if you're going to use headings and subheadings, it's only to better the flow and organization of your essay. So when you keep that in mind, you can structure it how you want. Any other questions?
Hi, Lavita. Sorry, am I audible?
Yes, you're fine.
Sorry, I just had one question about the group counseling vignette. So, in the vignette, it doesn't say anything about the client's parents and information about that. So I'm wondering if that's something that we need to include in the genogram, or is it okay if we don't include
It's
that?
fine. I think there's very little information there about, I think there's something around trauma, isn't it? So
Yeah.
just a little bit there should be fine. Don't have to go about making too many assumptions there.
All right. Okay.
But I
Thank you.
don't think it's going to be relevant. I mean, the issues are, but I don't think the gender and stuff is relevant to your formulation. So
Right. So it's okay if we should still include the parents, but in the genogram, but not go into too much detail about
don't worry about that. Yeah.
it. All right. Okay. Thank you.
Will we be marked down if we don't have 20 references? Sorry. The answer to that is, if you're going to link your formulation and strategies to literature, and research, not just theory, I imagine 20 references at the very least what you will need, because I can't imagine explaining all of those wonderful issues that we are picking up and not linking them to theory. So if you can do it with less than 20 references, no, of course we're not going to mark you down, but I'd like to see how that's done. I'm not sure it's possible, if that makes sense. Is there a specific mark allocated to the genogram? No. No, it's just an overall sense of how much depth is given. Can we explain all of this? Are most of the issues picked up and depicted, April? Yep.
Sorry, just following from that, Lavita, then if with the genogram, if we're given very little information in terms of, usually it's like 3 generations. If we only had this generation and the children, do we then still bother doing the parents and question mark, or just leave it, like just
Put a question mark there because it still will alert, because it will still alert us that you're thinking about it, right? Because if
Okay.
it's not there, I don't know what you're thinking.
Okay.
If
Okay.
you even considered it, right?
Okay. Okay. Thank you.
Michelle, I know it's semantics, but would you consider the Gottman method a theory in its own right or a strategy? What's the end point of the question? What will we mark you down is what you're asking? The Gottman model, right? It's a model. So it doesn't matter as long as you formulate the case yourself. Okay. Nora says 20 references or 20 sources. What's the difference?
Oh, so what I mean by that is, does that mean during the course of the 2,000 words, we should be linking back to research at least 20 separate junctures during the 2,000 words? Or does that mean we need 20 different, like, for example, on EFT?
Sources.
Yeah.
Sources. I think,
Yes.
yeah, so I think you're meaning the difference between citations and sources, right? So in-text citations is you can use the same source and cite multiple times. So no, that's what I mean. So references is sources, 20 different sources.
Oh, okay. Thank you.
Yeah. Ronnie, you have a question. Oh, good question. Format-wise, should tables, diagrams be inserted in the essay or put at the end as appendices? I don't have a preference, Ronnie. But I'm thinking the genogram would be in the essay because we've asked for it explicitly. For tables, ethics, it's done both ways. As long as there's a link to your case, I don't have a preference. No problem.
So sorry, that's me again. So for those of us who have not done ethics, I have not done an ethics course. Like, am I going to be I guess disadvantaged with the risk thing, because then do I need to go and read up on all the different ethical things?
We've covered the relevant principles in week 3. I think that should suffice.
Okay.
Okay. I don't think there's anything significantly different that's going to be in this that would not have been covered in week 3. So I think that should be okay. Isabella says, do the 7 principles of Gottman's methods. If I start to say this, I'm going to be getting very specific. And so I'm going to choose to avoid that question. What I will reiterate is strategies are very different from formulation. Okay, so strategies are 7 different strategies to address specific issues in your formulation, if that makes sense. Roseanne. Yes, Roseanne.
Just one question on the last question about the special considerations, ethical considerations and the risk. I read that as talk about the ethical things to consider, but also other risks. Am I wrong in reading that? Or yeah, okay. All right, thanks.
Most of it would have been covered in we had, issues around diversity and things like that. So yeah.
Yeah, all right, thank you.
Any other questions? I don't have a tool. No, that's okay. Well, I'm glad. Okay, so if there is anything else that I can assist you with, feel free to, in the first instance, post in the forum, because what it means is I'm sure someone else will also have similar questions, and so then it just advantages everyone else. And if not, if it's still not answered, then feel free to reach out to us. Okay. Well, I'm going to stop the recording here.